Mental health crises in Africa, breaking chains, restoring hope. Mental health conditions in Africa are reaching alarming levels, demanding urgent attention and action. This feature sheds light on the dire situation faced by mental health patients in Africa, particularly those in conflict-ridden areas such as Kenya, Ethiopia, and Somalia. Physical scars may tell stories, but the hidden struggles of mental health patients paint a grim picture of neglect, isolation, and despair. Mental health conditions in Africa have reached a critical point, with governments, aid communities, and societies at enormous failing to provide adequate support. The impact is disproportionately severe in regions grappling with war, drought, and famine. These vulnerable communities not only bear the burden of external hardships, but also suffer trauma-induced illnesses and congenital mental disabilities. In countries plagued by conflict, where infrastructures have crumbled and mental health professionals have fled, the treatment of mental health patients is often characterized by a haunting similarity, a life in chains. This report highlights the significant role that organizations like Hepto play in addressing these challenges. Hepto is deeply committed to addressing the mental health crisis in Africa. The organization's efforts focus on multiple fronts. 1. Training mental health workers. Hepto is investing in training mental health professionals to deliver effective and compassionate care. 2. Raising awareness. Hepto recognizes the importance of informing administrations about the significance of mental health patient care. By fostering understanding at the policy level, Hepto aims to create an environment conducive to change and improvement. 3. Strengthening public outreach. Hepto is actively engaged in spreading awareness about mental health conditions to promote acceptance, understanding, and empathy. Case study: Life in Chains, mental health patients in Africa, where the areas of prolonged conflict and insecurity have left a lasting impact on psychological well-being. Shockingly, 1 in every 3 people in the region is grappling with some form of mental illness. Many have endured unspeakable acts of violence, ranging from physical abuse to witnessing brutal atrocities against loved ones. In Africa, where communal and family ties are deeply rooted in culture, the isolation faced by mentally ill individuals is particularly agonizing. With inadequate mental health infrastructure, many patients are chained or imprisoned, further exacerbating their suffering. A handful of poorly managed mental health centers exist, leaving the majority of mentally ill patients without access to care. The urgent need to address mental health conditions in Africa cannot be understated. Organizations like Hepto are taking commendable strides to train professionals, raise awareness, and extend support to mental health patients who have long been neglected. By breaking the chains that bind these individuals and restoring hope, Hepto is paving the way for a more compassionate and inclusive society that embraces those suffering from mental health conditions. It is through collective efforts, empathy, and action that Africa can overcome the mental health crisis that has plagued its people for far too long. Join us in our mission to support mental health in East Africa. You can donate using the details provided or visit our website at www.hepto.org. Hepto, we empower, enliven, and enrich.